Respiratory pharmacology. 1. Bronchodilators. Bronchodilators are a class of medications used to relax and widen the airway passages in the lungs, bronchi and bronchioles. They are primarily used to treat and manage conditions characterized by airway constriction or narrowing, such as asthma, chronic obstructive pulmonary disease, COPD, bronchitis, and other respiratory disorders. By dilating the airways, bronchodilators help to improve airflow and relieve symptoms like coughing, wheezing, and shortness of breath. There are several types of bronchodilators, including I-beta-2 adrenergic agonists. These medications work by stimulating beta-2 receptors in the smooth muscle of the airways. This stimulation causes the muscles to relax, leading to bronchodilation. Beta-2 agonists can be classified into short-acting and long-acting varieties, and they are often used as rescue or maintenance medications for asthma and COPD. 1. Short-acting beta-2 agonists, SABA. Examples include albuterol, Ventolin, Proventil, and levobuterol, Soponex. 2. Long-acting beta-2 agonists, LABA. Examples include salmeterol, Ceravent, and formoterol, Foridil. Albuterol. Albuterol is a commonly used bronchodilator medication that belongs to the class of drugs known as beta-2 adrenergic agonists. It is used to treat and manage various respiratory conditions, primarily those characterized by airway constriction or bronchoconstriction. Albuterol is known by several brand names, including Ventolin, Proventil, and others, and is available in different forms, such as inhalers, nebulizer solutions, and oral tablets or syrup. Key points about albuterol. Mechanism of action. Albuterol works by binding to and stimulating beta-2 receptors on the smooth muscle cells of the airways. When these receptors are activated, it leads to the relaxation and dilation of the bronchial tubes, resulting in increased airflow and relief from symptoms like wheezing, coughing, and shortness of breath. Indications. Albuterol is primarily used for the treatment of conditions like asthma, chronic obstructive pulmonary disease, COPD, bronchitis, and other lung diseases with reversible airway obstruction. It is often prescribed as a quick relief or rescue medication for acute symptoms and as a preventive measure for exercise-induced bronchoconstriction. Forms. Albuterol is available in various forms, including 1. Metered-dose inhalers, MDIs. These inhalers deliver a measured dose of albuterol in aerosol form, which can be inhaled directly into the lungs. 2. Nebulizer solution. Albuterol can be used with a nebulizer machine to create a fine mist for inhalation, particularly for young children or individuals who have difficulty using inhalers. 3. Oral tablets and syrup. In some cases, oral albuterol may be prescribed, although it is less common than inhalation forms. Usage. Albuterol is typically used on an as-needed basis to relieve acute symptoms, especially in the case of asthma attacks or sudden exacerbations of COPD. It can also be used as a preventive measure before activities that may trigger bronchoconstriction, such as exercise. Side effects. Common side effects of albuterol may include increased heart rate, tachycardia, jitteriness, trembling, tremors, headache, and increased blood pressure. These side effects are usually mild and temporary. Precautions. Albuterol should be used with caution in individuals with certain medical conditions, such as heart problems or high blood pressure. It is essential to follow the prescribed dosage and administration instructions to avoid overuse. Interactions. Albuterol may interact with other medications, so it's important to inform your healthcare provider about all the medications you are taking. 2. Anticholinergics. These medications block the action of acetylcholine, a neurotransmitter that causes the airway muscles to contract, leading to bronchoconstriction. Anticholinergic bronchodilators are typically used in the treatment of COPD and may be combined with beta-2 agonists for enhanced effects. 1. Short-acting anticholinergics, SAMA. Examples include ipratropium, Atrovent. 2. Long-acting anticholinergics, LAMA. Examples include tiotropium, Spiriva, and aclidinium, Tidorza. Ipratropium is a medication that belongs to the class of drugs known as anticholinergics. It is primarily used as a bronchodilator to treat and manage respiratory conditions characterized by airway constriction, particularly chronic obstructive pulmonary disease, COPD, and asthma. Ipratropium is available under various brand names, including Atrovent. Here are some key points about ipratropium. Mechanism of action: ipratropium works by blocking the action of acetylcholine, a neurotransmitter that causes the airway smooth muscles to contract and the airways to narrow. By inhibiting acetylcholine's effects, ipratropium leads to bronchodilation and increased airflow in the lungs. Indications: ipratropium is used for the management of chronic obstructive pulmonary disease, COPD, including chronic bronchitis and emphysema. It may also be used in the treatment of asthma, particularly when bronchoconstriction is not fully responsive to other medications like beta-2 adrenergic agonists. Forms: ipratropium is available in inhalation forms, such as metered-dose inhalers, MDIs, and nebulizer solutions. Inhalation is the preferred method of administration to ensure the medication is delivered directly to the lungs. Usage: ipratropium is typically used on a regular basis, either alone or in combination with other bronchodilators, as part of a long-term maintenance regimen for COPD. It can also be used for acute symptom relief in certain cases of asthma and exacerbations of COPD. Side effects: common side effects of ipratropium may include dry mouth, sore throat, cough, and headache. These side effects are usually mild and temporary. Ipratropium is considered a safer alternative in patients who may be sensitive to beta-2 adrenergic agonists, which can sometimes cause heart-related side effects. Precautions: ipratropium is generally well tolerated, but it should be used with caution in individuals with a history of narrow-angle glaucoma or an enlarged prostate, benign prostatic hyperplasia. It is important to follow the prescribed dosage and administration instructions to avoid overuse. Interactions: ipratropium is typically not associated with significant drug interactions, as it acts locally within the airways. However, it's essential to inform your healthcare provider about all the medications you are taking. 3. Xanthines. Xanthines are a group of naturally occurring compounds that include caffeine, theobromine, and theophylline, as well as their synthetic derivatives. These compounds have various physiological effects on the human body and are used in medicine for their bronchodilatory and stimulant properties. Xanthines work by inhibiting an enzyme called phosphodiesterase, which increases the levels of cyclic AMP in cells. This leads to smooth muscle relaxation and bronchodilation in the airways. Theophylline. Theophylline is a medication that belongs to a class of drugs called xanthines. It is primarily used as a bronchodilator and smooth muscle relaxant, particularly for the treatment of respiratory conditions characterized by airway constriction. Theophylline has been used for many years to manage conditions such as asthma and chronic obstructive pulmonary disease, COPD. Here are some key points about theophylline. Mechanism of action: theophylline works by relaxing the smooth muscles in the airways and blood vessels. It does this by inhibiting an enzyme called phosphodiesterase and increasing the levels of a signaling molecule called cyclic AMP. This leads to bronchodilation and improved airflow in the lungs. Indications: theophylline is used for the treatment and management of asthma, chronic bronchitis, emphysema, and other conditions where bronchoconstriction and airway inflammation are issues. It is often used as a maintenance medication to help control and prevent symptoms. Forms: theophylline is available in several forms, including extended-release tablets, immediate-release tablets, and elixirs. The choice of formulation depends on the specific condition and the desired duration of action. Usage: theophylline is taken orally and is generally used as a long-term or maintenance medication to keep airways open and reduce the frequency and severity of symptoms. It is not typically used for acute symptom relief during asthma attacks or exacerbations. Blood level monitoring: theophylline levels in the blood need to be monitored regularly to ensure that they stay within a therapeutic range. This is because theophylline has a narrow therapeutic window, meaning that the difference between a therapeutic and toxic dose can be relatively small. Side effects: common side effects of theophylline may include nausea, vomiting, headache, rapid heart rate, tachycardia, and nervousness. In high or toxic doses, it can cause serious side effects, such as seizures and arrhythmias. Precautions: theophylline should be used with caution in individuals with certain medical conditions, including heart problems, liver disease, and ulcers. It may also interact with various medications, so it's important to inform your healthcare provider about all the medications you are taking. Interactions. Theophylline has a significant potential for drug interactions, and the dose may need to be adjusted when other medications are introduced or discontinued. Alcohol and tobacco can also affect the metabolism of theophylline.